Hello everyone and welcome to a new video. So here we will explain in details the spinal cord injury classification according to the American Spinal Injury Association. So American Spinal Injury Association classification of spinal cord injury is the gold standard nowadays to classify these injuries. And to classify the spinal cord injury according to the American Spinal Injury Association, neurological examination has to be done looking for sensory or motor deficits. We start with the motor examination, and it is using the muscle power of the key muscles only, looking for any motor deficits. So you know that the motor examination usually contain many parts: inspection, tone, power, reflexes, and coordination. But for grading of the spinal cord injury, we only need the muscle power of the examination. And that's for the key muscles that will be explained in the next slide. Sensory examination, on the other hand, is done using superficial modality, which is the pinprick. This is the preferred one. And the deep modality that is preferred is the touch, only looking for any deficits. So also the sensory examination contains the superficial modality, the deep modality, and the cortical sensation, but we only need the superficial modality and the deep modality. And the pinprick and the touch are the preferred ones. So the key muscles for the motor examination, we have the C5, C6, C7, C8. So for the C5, those are in the upper limbs, and the T1 also in the upper limbs. So for the C5 is the elbow flexors, the C6 for the wrist extensors, C7 is for elbow extensors, and C8 for finger flexors, and the T1 is for the fifth finger abductors. And the rest of the muscles are in the lower limbs. So the L2 is the hip flexors, the L3 is the knee extensors, the L4 is the ankle dorsiflexors, and the L5 is the big toe extensors, and the S1 is for the ankle plantar flexors. Now, we mentioned that for the motor examination, we test for the muscle power, and for the sensory examination, we test for the superficial and deep modalities. So the muscle power is graded out of 5 according to the MRC grading. So grade 0 out of 5 is no muscle movement. So if your patient has no muscle movement in one of the key muscles, it's graded as 0. If it is visible muscle movement but with no movement at the joint, it's graded 1. Grade 2 is movement at the joint but not against gravity. Grade 3 is movement against gravity but not against added resistance. And grade 4 is movement against resistance but less than normal. And grade 5 is normal power. The sensory, on the other hand, is graded out of 2 according to the 0 is absent sensation, the 1 is altered sensation, meaning that one of the modalities is positive and the other one is negative, and the 2 is normal when both of the modalities are positive. Now you follow these steps for classification. So step 1, you determine the sensory levels for right and left sides. Each side should be graded independently. So intact dermatome must be responding to pinprick and light touch sensation. So in step 1, you basically look for the sensory levels and you test for every dermatome looking for deficits. And with the intact dermatome must respond to both the pinprick and light touch. Now after you looked for the sensory levels, now you look for the motor levels. So you determine the motor levels for right and left independently. Same with the sensory. The motor level is defined by the lowest key muscle on the body with the grade 3 power, and the muscles above this muscle must be grade 5. The motor level by lowest key muscle with the grade 3 power, and the muscles above this muscle must have a grade 5 power. Now in grade 3, you determine the neurological level of injury, the NLI, neurological level of injury, and it refers to the lowest segment with intact sensation and motor function. It grade 3 muscle power, as we mentioned, and the neurological level of injury is the lower level of the sensory and motor levels assigned in step 1 and step 2. So basically, after you grade the sensory and you find the motor levels and the sensory levels as the step 1 and step 2, the lowest of them is the neurological level of injury in step 3. And in step 4, you determine if the injury is complete or incomplete. If the patient can't voluntarily contract anal sphincter and sensory exam of S4 and S5 is 0 and deep anal pressure is negative, then the injury is complete. And otherwise, the injury is incomplete. So basically, if those are negative, the anal sphincter contraction, the sensory exam of S4 and S5, and the deep anal pressure is negative, this means that the injury, the spinal cord injury, is a complete injury. And otherwise, the injury is incomplete. And step 5, now you can determine the injury grade according to the American Spinal Cord Injury Association impairment scale. So this is the American Spinal Cord Injury Association impairment scale. It's also called the American impairment scale. So basically, this is the final grading. You grade the patient either A, B, C, D, or E. So you grade the patient A grade spinal cord injury when there is a complete injury, there is no sensory or motor at the S4 and S5. You grade the patient a grade B motor spinal cord injury. That is when there is sensory incomplete injury, meaning that the sensory is preserved below the neurological level of injury, including the sensation at the S4 and S5, but motor function is preserved only to 3 levels below the motor level on either side of the body. A grade C is the motor incomplete injury, meaning the motor is preserved at the S4, S5, or the patient's sensory is preserved at the S4, S5 with the preservation of more than 3 motor levels below the level of injury. We mentioned that in the grade B, there is only 3 motor levels. Motor function is preserved only to 3 levels. But in grade C, it is more than 3 levels below the level of injury. And below this, the level of injury, less than half key muscles below level of injury have muscle power of equals to 3 or more. In grade D, it is the motor incomplete grade. It is the same as the grade C, with more than half muscles below the level of injury have muscle power of grade 3 or more. So basically, if you find that there is a preservation only to 3 levels below the level of injury, this means that the grade is grade B. If it is more than 3 motor levels or 3 levels below the level of injury, the motor examination is preserved. It is either grade C or D. A grade C, if those 3 or more levels have muscle power of more than 3 or less than half the key muscles in those levels that we mentioned have muscle power to equals to 3 or more, it is grade C. If those muscles more than half of them have muscle power of 3 or more, it means that this is grade D. And grade E is normal. And with that, we reach the end of this video. Thank you guys for watching. Please make sure to like and subscribe. And if you want to support more, you can by subscribing to the Patreon, link provided in the description of this video. Thank you for watching, and peace.